Hi, I am Metaclopramide. So my generic name is also Metaclopramide. Then my brand names are Plazil and Plazimide. So my chemical name are
Metaclopramide is a para-aminobenzoic acid derivative dopamine receptor agonist in therapeutic drug class. In pharmacologic class, it is an antiemetic GI stimulant.
So my mechanism of action is that I cause antiemetic effects by inhibiting dopamine D2 and serotonin 5-H3 receptors in the chemoreceptor trigger zone or CTZ, located in the area postrema of the brain. So administration of this drug leads to prokinetic effects via inhibitor actions on presynaptic and postsynaptic D2 receptors, agonism of serotonin 5-HT4 receptor, and antagonism of muscarinic receptor inhibition. This action enhances the release of acetylcholine, causing increased lower esophageal sphincter or LES and gastric tone, accelerating gastric emptying and transit through the gut. So, I antagonize the dopamine D2 receptors. The dopamine exerts a laxative effect on the gastrointestinal tract through binding to muscular D2 receptors.
Pharmacokinetics. Absorption of metoclopramide. Metoclopramide is readily absorbed in the gastrointestinal tract with an absorption rate of about 84%. The bioavailability of the oral preparation is reported to be about 40.7%, but can range from 30 to 100%. Distribution. The volume of distribution of metoclopramide is approximately 3.5 liters per kilogram. This implies a high level of tissue distribution. Metoclopramide crosses the placental barrier and can cause extrapyramidal symptoms in the fetus. Metabolism. Metoclopramide is 30% bound to the plasma proteins, mainly to alpha-1 acid glycoproteins. Excretion. Metoclopramide undergoes the first pass metabolism and its metabolism varies according to the individual. This drug is metabolized by cytochrome P450 enzyme in the liver.
So my indications are prevent or reduce nausea and vomiting induced by ciplastine alone or with other chemotherapeutics, to prevent or reduce post-operative nausea and vomiting, to facilitate small bowel or upper GI intubation and aid in radiologic examination, then delayed gastric emptying caused by diabetic gastroparesis, then lastly is gastroesophageal reflux disease.
Contraindications. Metoclopramide is contraindicated in patients hypersensitive to the drug or any of its components. Patients allergic to procainamide may also be allergic to metoclopramide. Also contraindicated in patients taking drugs that are likely to cause extrapyramidal reactions, in those for whom stimulation of the GI motility might be dangerous, and in those with seizure disorder. Use cautiously in patients with history of depression, Parkinson's disease, hypertension, or renal impairment. Safety and effectiveness haven't been established for the therapy that lasts longer than 12 weeks. In pregnant women, use cautiously. In breastfeeding women, use cautiously. It's unknown if the drug appears in breast milk. In elderly patients, use cautiously and at reduced dosage.
So my side and adverse effect per body system. Central nervous system, I will give you anxiety, dizziness, drowsiness, dystoric reactions, extrapyramidal symptoms, fatigue, fever, headache, insomnia, lassitude, restlessness, sedation, seizure, suicidal ideation, and tardive or dyskinesia. For cardiovascular system, I will give you arrhythmias, AV block, bradycardia, heart failure, hypotension, transient hypertension. For gastrointestinal system, I will give you bowel disturbances, diarrhea, and nausea. So for hematologic, I will give you agranulocytosis, leukopenia, unitella, and neutropenia. So for integumentary, I will give you rashes.